Yeah. Hi, very good evening. I had some problem in streaming the video in the previous link, so I had to break it. So I hope it is streaming fine now, right? So we'll just go ahead with MCQs discussion. I shared a few MCQs last night in our Google group. I hope you have gone through them and I hope you have solved them. So we'll have discussion pertaining to those MCQs now. So first of all, a very good evening all of you. Right. Okay. Yeah, we'll proceed with our MCQ discussion, right? So we'll start with our first MCQ. So we have shared, a total of 10 MCQs last night in our Google group, right? So I hope you have solved. So first we'll proceed with our first one. Which local sign of acute inflammation is caused by dilation of capillaries? So we have options: redness, heat, swelling, and pain. So give me the answer. We'll have a discussion pertaining to this in brief, right? So first question: which local sign of acute inflammation is caused by dilation of capillaries? Redness, heat, swelling, and pain. Hi, a very good evening. Yes, so as you all know, we have various cardinal signs of inflammation. So apart from redness, you have rubor redness, you have calor, tumor, dolor, as well as functional leisure, right? We have discussed this previously also. So redness is mainly attributed because of dilation of capillaries, right? And why do you see this swelling, or why do you see this pain, or why do you have this kind of these manifestations? So what are the physiological reasons behind these signs of inflammation? Yeah, hi, very good evening. Yes, as you said, dilation of capillaries causes redness. Then why do you have swelling? What could be the reason for swelling? And what is the reason for calor or heat generation? Yes. So we have these cardinal signs of inflammation. Rubor, calor, tumor, dolor, and loss of function or functio laesio, right? So rubor is nothing but redness. So this redness is mainly because of dilation of capillaries, isn't it? What about calor? So why do you see increased heat production? So what could be the reason for calor? Yes, swelling, as you said. So you just go as per the line here. So calor is heat generation because of increased flow of blood, isn't it? And also because of increased metabolic activity of various inflammatory cells, including your neutrophils as well as macrophages, right? So that's the reason for your rise in temperature. And what about tumor or swelling? As I said, because of increased capillary permeability. Increased capillary permeability. And then dolor, because of lysis of cells, there is also simultaneously a production of various chemical mediators like bradykinins as well as the prostaglandins, right? So these lead to pain. And these 4 signs of inflammation, called as cardinal signs of inflammation, are given by Celsus, isn't it? And the 5th sign is given by virtue functio laesio, or loss of function, right? So these are the reasons why we see various signs of inflammation. Clear, isn't it? So which local sign of acute inflammation is caused by dilation of capillaries? It is redness. And because of increased flow of blood and because of increased metabolic activity of various cells, there can be calor. Increased capillary permeability leads to tumor or swelling or extravasation of fluid. and pain mainly because of your release of inflammatory mediators including bradykinins and prostaglandins, and also there is functional lazy or loss of function. Good. Yes. Now let's proceed with the second question. A dentist is often consulted first by a patient with pernicious anemia for relief of denuded gingiva, glossitis, edematous buccal mucosa, severe gingivitis. So they are indirectly asking you the oral manifestations of pernicious anemia, isn't it? Yes. So a dentist is often consulted first by a patient with pernicious anemia for relief of. So what are the various oral manifestations of pernicious anemia, and what is this pernicious anemia all about? Yes? Good. So as you know, pernicious anemia it's because of decreased production or intrinsic factor in the gastric juice. So this intrinsic factor is essential for absorption of vitamin B12, which helps in maturation of your erythrocytes, isn't it? So as a result of this deficiency, we find megaloblasts, as you all know. So the oral manifestations of pernicious anemia include angular cheilitis. There can be atrophic glossitis, also tingling sensation in the peripheries. That doesn't come under oral manifestations as such, right? So these are some of the important oral manifestations pertaining to pernicious anemia, as it is because of deficiency of intrinsic factor. Good. Also, along with this, we will have the symptoms such as dysphagia, right, and also odonophagia, right? So these are some of the symptoms: odonophagia and dysphagia. Dysphagia is nothing but difficulty in swallowing, whereas odonophagia is nothing but painful swallowing. So even these are included under your symptoms or your manifestations in oral cavity, right? Yes. It can be autoimmune disease, viral disease, or any factors which lead to destruction of cells producing an intrinsic factor. Good. So oral manifestations, you can have angular cheilitis, there can be atrophic glossitis, dysphagia, difficulty in swallowing, odonophagia, which is nothing but painful swallowing, right? So these are some of the manifestations. So the common problem which patients complain of, or the reason why they are coming to dentist, is because of sores or because of ulcers or glossitis, right? So a dentist is often consulted first by a patient with pernicious anemia for relief of glossitis. So if you know the oral manifestations of pernicious anemia, then you can answer such questions with ease, right? So this is another different approach of questioning, right? Yeah. Hi, oh, very good evening. Yes, now let's move on to the third question. The greatest number of skin cancer related deaths worldwide is caused by basal cell carcinoma, actinic keratosis, squamous cell carcinoma, malignant melanoma. Yes. Yes, Falak. Hunter's glossitis or Moeller's glossitis. So the greatest number of skin cancer related deaths worldwide is caused by. So which is the appropriate answer? Yes. So malignant melanoma, we have a few important points. Basically, it's a malignancy involving melanocytes. So malignant melanoma, we have this ABCD criteria, right? And also it affects commonly males. It has predilection towards males than females, and usually seen above 50 years. After a fifth decade, incidence is more common after fifth decade of life, right? And we have this ABCD criteria. So what does A, B, C, and D stand for? To make it fast so that we can proceed to the next question. And you know what? These malignant melanomas, even though they contribute to only 4% of overall skin cancers, these are the leading cause of skin cancer related deaths worldwide. So you need to make note of that point, right? So malignant melanoma, 4% of skin cancers. So what does A, B, C, D criteria stand for? Good. A for asymmetry. B for border irregularity. C for different colors. Yeah. C for color. Color variability. You can have brown, black, blue, gray or pink colors. There can be color variability. And D for diameter. Diameter often greater than 1/4 inch. Right? So these are some of the clinical features. As we discussed, it has male predilection and also usually seen after 5th decade of life. There is greater incidence of malignant melanoma. Usually it's because of sunburns or because of UV radiation, and we have this ABCD clinical features. A for asymmetry, B for border irregularity, C for variable color or color variability, and D for your diameter greater than 1/4 inch, right? Okay, so what does E stand for, Sonal? And also, this malignant melanoma in oral cavity is very rare, but if at all it occurs in oral cavity, it has predilection towards your palate and maxillary gingiva. So, oral manifestations, if at all, it can involve your palate as well as your maxillary gingiva or alveolar ridge, right? So malignant melanoma accounts for only 4% of all skin cancers, in spite of only 4%, which is comparatively less. It accounts for greater skin cancer related deaths worldwide based on the statistics. E for extent of lesion. Okay. Right. So we have this characteristic horizontal extension as well as your, radial extension and your vertical extension, right? Maybe. Yes, Falak, if you have streaming issue, you can just restart your window or restart your app, right? So we'll just proceed with our next question. So I think we are in 4th, right? Yeah. Let's move on to the 4th question. Dissociative anesthesia is a unique method of pain control that reduces anxiety and produces a trance-like state in which the person is not asleep but rather feels separated from his or her body. The primary medication used for dissociative anesthesia is Demerol, ketamine, pentobarbital, promethazine, hydrochloride. So what is the medication which is used for dissociative anesthesia? It is streaming here. I'm not sure how it's happening on your side, but here it is streaming fine. Yeah. So dissociative anesthesia, as they are given in the description of the question itself. Patient, he'll be open, like he'll be awake, but he doesn't feel, he is in a trance-like state, he doesn't feel any pain. Along with this ketamine, we also give a sedative, which lasts for another 20 to 30 minutes. So ketamine is a drug of choice, right? And also make a note of the duration of this dissociative anesthesia. So ketamine is the drug of choice, and this trance-like state lasts for around 10 to 20 minutes, right? It's mentioned as 10 to 30 minutes where you will have this trance-like state, and there will be anesthesia or pain control for 30 to 40 minutes. So you can just make a note of these values, right? So this trance-like state extends for a duration of 10 to 30 minutes, whereas pain control will be seen till 30 to 40 minutes. And also it's mentioned that along with this ketamine, it's also advisable to give a sedative in order to reduce the anxiety of a patient, right? So eyes will be wide open, but he doesn't have any pain. Okay, so now E for elevation in malignant melanoma. Okay, fine. I mean, I don't know what's the problem, because even in the afternoon we had some issues with our internet also, but now I think it is streaming fine comparatively, because I don't see any breaks here. I mean, is anyone else facing the same problem, the streaming issues? Okay, so you say E for elevation. I mean, have you referred Schaefer's? Okay. Yes. So also make a note, along with that, this ketamine also increases your bronchial secretions. I hope you can see, right? Yeah, bronchial secretions as well as salivary secretions, right? So ketamine increases these secretions, bronchial secretions as well as salivary secretions, and also it increases blood pressure, muscle tone, right? I'm just writing in small letters, and also heart rate. So these are the clinical effects of your ketamine. It increases various secretions, salivary secretions, bronchial secretions. Also it increases blood pressure, heart rate, as well as muscle tone. However, we can have hallucinations as a side effect to this medication, right? Just make a note of that point. So dissociative anesthesia is useful in emergency situations where patient has trance-like state, and the agent of choice is ketamine. Okay, Sonal, thank you so much. So we have another E here, A, B, C, D, E, where E stands for elevation, right? So thank you, Sonal, so much for referring and for letting us know. Okay, now let's move on to the next question. In fact, when I posted this question yesterday, Aishwarya was asking whether it's a trick question or whether it's by mistake I've given the options. So I've given few options for you, right? When writing a prescription, fifth question by the way, when writing a prescription, QID is the abbreviation for what? You have options 2 times a day, 3 times a day, after meals, etc., right? So which is the right option? Or according to you, what does QID stand for? Yes, Prithvi, what else or what drugs can be used further for dissociative anesthesia? Even nitrous oxide, laughing gas can also be used. Nitrous oxide can also be used for dissociative anesthesia. Alright? Yes, QID is every 4 hours or is it 4 times a day? Because both have a different meaning, right? If it is every 4 hours, then it has to be around 6 times a day. QID. So okay, make a note of all these abbreviations. In exam, in our practicals in pharmacology, there was one bottle of glycerol, and on that bottle it's mentioned as Q.S. So what does this Q.S? QS stand for? By the way, I couldn't answer, but my internal was so good that he gave me the answer. Along with the answer, he gave me marks also. Good, Abhishek. Porter in dye. Right. So what does this QS stand for? Okay, try answering that. In the meantime, we'll go through other abbreviations, right? Yeah. So BID is twice a day, isn't it? And then you have TID, 3 times per day. STAT, stat, means immediately. And then PRN, which means as needed. PC, after meals. And then you have Q4H, which means, as you said, every 4 hours. And Q12H, which means every 12 hours or 2 times a day, isn't it? And you have HS, which means bedtime, and AC is before meals, right? So PC is after meals, AC is before meals. Just remember, AC, you should have air conditioning, cool, before having something. You need to be relaxed, right, before you start having your meals. And after having meals, you need a personal computer. So just remember it that way. AC is before meals, PC is after meals. Good, Sanjay. Nice. So QS in fact stands for quantum sufficientum, or as much as required. So there is no particular value for it, like how much ever you feel like adding, depending upon the material which is there, depending upon the pharmacological agent, that's quantum sufficientum, as much as required. Good. Yes, answer is none. Yes, you don't have an answer in the given options. Anyways, QID stands for 4 times a day. I mean, I'm not sure how many of you answered this question last night. Okay, fine. So as you can see, BID is twice a day, TID is 3 times a day, STAT immediately, PRN is as needed, PC is after meals, AC is before meals, HS bedtime, Q4H every 4 hours, and Q12H every 12 hours. Right? Okay. So now let's proceed with the 6th question. Hemophilia A is characterized by deficiency of. None of the above. You don't have answer there. It is QID is 4 times a day, right? Yeah. Hemophilia A is characterized by deficiency of clotting factors 9, 8, 11, or 1 Willebrand factor. So, what is hemophilia A? I can just make a note here. Hemophilia A, due to deficiency of factor 8, and this is most commonly seen. Hemophilia B, deficiency of plasma thromboplastin component, or Christmas disease, isn't it? So hemophilia B is also called as Christmas disease due to deficiency of plasma thromboplastin component. And you have something called as hemophilia C, which is also called as Rosenthal's syndrome. Rosenthal's syndrome, due to deficiency of factor 11, which is plasma thromboplastin antecedent, factor 11. I hope you can see. Right. So hemophilia A is deficiency of factor 8, hemophilia B deficiency of factor 9, Christmas disease, and hemophilia C, parahemophilia, also called as Rosenthal's syndrome due to deficiency of factor 11, plasma thromboplastin antecedent, right? Of all these three, hemophilia A and B are sex linked, whereas hemophilia C, it's not sex linked, right? Board is not clearly seen means it is streaming at a lower quality for you, I think. I can just try 720D or HD quality. In that case, you can clearly see the board. Yes, Prithvi, von Willebrand's disease, it's an autosomal dominant disorder because of deficiency of your glycoprotein, which is essential for binding to your factor 8, or also essential for binding or aggregation of platelets, and helps or enables in forming platelet plug. Right, so that is your von Willebrand's disease. It's an autosomal dominant disorder. So von Willebrand's disorder or disease is an inherited autosomal dominant disorder because of deficiency of glycoproteins, which are essential for platelet aggregation. So platelet plug is seen because of this von Willebrand factor. This glycoprotein is called as von Willebrand factor. Right, and also a question for you. In case of your deficiency of factor 8 or factor 9, so what happens to your bleeding time and clotting time? And also prothrombin time and your partial thromboplastin time. We have discussed this in detail in our key points. You can answer this now. So in case of your clotting factor deficiency, what are all the timings which increase because of this clotting factor deficiency? So what happens to bleeding time first? So bleeding time, in case of hemophilia, remains normal, right? Nothing to do with your platelets. Whereas clotting time obviously increases, and activated partial thromboplastin time also increases, right? Yes. We have this intrinsic factors and extrinsic pathway, right? Intrinsic pathway and extrinsic pathway. So whenever intrinsic pathway is involved, APDT increases. Whenever extrinsic pathway is involved, PT increases, right? We have discussed that in detail previously also. Yes, good. Prothrombin time again remains normal, but there is prolonged partial thromboplastin time. Good. So let's proceed with the next question. So hemophilia A is characterized by deficiency of factor 8, option B, right? And also remember, both hemophilia A and B, they're sex linked, and females are usually carriers, and it doesn't affect females, it only affects males, right? It affects males, and females act as carriers for hemophilia. And if at all there is hemophilia, I mean hemophilia A is most commonly seen among all types, and if at all present, there can be clinical presentations will start below 25 years of age itself. There can be bruises, there can be bleeding within joints, and whenever there is any injury, there will be continuous bleeding without any plug formation or without any stoppage of bleeding, right? Continuous hemorrhage. So the majority of people affected with hemoglobin A, they have these clinical presentations below the age 25 years, right? And symptoms include excessive bleeding from minor cuts, there can be bleeding from nose or epistaxis, hematoma formation, etc. You just add up these points. Good. Now let's move on to our next question. 7th question. Which surgical approach is best to expose TMJ? Preauricular approach, submandibular, both are same, or none of the above? So which surgical approach is best to expose a temporomandibular joint? So assume that you have your, I think, is it visible if I draw here, right? You have your ear here, right? So you place an incision anterior to the ear perpendicularly. So the incision has to be perpendicular to the surface, parallel to the superficial temporal artery, and it has to proceed upwards 1 inch above your zygomatic arch. If this is your zygomatic arch, the incision has to be 1 inch above your zygomatic arch, and inferiorly it has to go till the tip of your pinna or to the inferior aspect of your earlobe. So this is how this preauricular incision is given, right? And by giving this incision, we are trying to expose or access your condyle from the posterior aspect. That's very, very important, right? So preauricular approach is considered to be the best approach or best way to access your temporomandibular joint, right? So a perpendicular incision is made just anterior to the external ear, parallel to the superficial temporal artery, and then from there it extends 1 inch above the zygomatic arch to the lower extremity of the ear, right? And care has to be taken not to involve your vessels or nerves, facial nerve, facial vessels in that particular area, as it is richly innervated, right? So preauricular approach is the best approach. And then you have your residence approach or submandibular approach. So submandibular approach, option B, is also called as residence approach. So this residence approach is a standard surgical approach to the ramus of mandible and neck of the condyle. You can just make a note of that point, right? So to access the ramus of mandible and the neck of the condyle, we go through this submandibular or residence approach. So preauricular approach is considered to be the best incision to expose your temporomandibular joint. Option A is more appropriate. Right. So we move on to the 8th question. Documentation or documents that contain information concerning a hazardous chemical are called. Documents that contain information concerning a hazardous chemical are called ADBCs, MSDS, HGPF, TRDP. I mean, if you can Google anytime, you can just Google glass ionomer cement or any dental material, you will get these sheets. Good, Prithvi, very good. Material safety data sheets, where in this material material safety data sheets, it is available in form of PDF in your, if you can just search, you will get all the information pertaining to the chemicals, what precaution should be taken if at all there is any injury with that kind of chemical, and what could be the possible side effects or hazardous effects concerned with that material. So all material aspect, all aspects pertaining to that material in terms of your safety and precautions will be mentioned in your material safety data sheets. All manufacturers are bound to make these sheets available to all those who are buying them, including the dental operators, right? You can just Google, you'll just get various material data sheets. So MSDs stands for Material Safety Data Sheet. Right? Yeah. Move on to the 9th question. Arrange the following 7 steps in the educational process in their correct order. For example, you are conducting a dental camp. You identify some problems associated with a particular community. So you are trying to give a health talk. So how do you identify their needs and how do you motivate them And how do you educate them with various oral hygiene procedures or whatever, depending upon the requirement. So in that scenario, arrange the following 7 steps in the educational process in their correct order. And the options given are expressing needs, stimulating motivation, recognizing needs, evaluating results, reinforcing learning, setting goals, acting to achieve goals. So you have 7 items in the given options. So arrange them in the following order. So just assume that you're organizing a dental camp there, you're planning for a health talk. So what all elements would you start looking into right from the beginning till the end? So arrange the following 7 steps in the educational process in their correct order. I mean, you have options over there, you can just give the sequence of options rather than typing the entire word. I thought you would be giving me ready-made answers because I shared the file yesterday. So still there is some delay. Good for luck. CABEFGD. Okay. I'll give you 2 minutes. Please make it as fast as possible because we still have another live session at 8 p.m. right? Good Prithvi, CABEFGD. Yes, Niharika. Yes, finally you have validating results, right? Good, good Preeti. Hi Regina. Yes, then Lakshmi. Recognizing, expressing, stimulating motivation, setting goals, reinforced learning, acting to achieve goals. Okay, fine, good, very good. So first one is recognizing needs. What are the specific requirements or what are the needs of your target population, right? Recognizing needs as you all rightly mentioned. Yes. Then, yes. Okay. CABEFGD. Yes. So once needs are recognized, then you will allow the target population to express their own needs, right? So recognizing needs followed by expressing needs and then stimulating motivation. You can either through a talk or through actions, or it can be any means of presentation, stimulating motivation, which is very essential, and then allowing them or taking their help or advising them to set goals which have to be practical, attainable, right? So the goals which are set have to be meaningful, attractive and attainable. It can be either your PG preparation or it can be any goal. It has to be practically feasible, attractive and it has to be meaningful. So after setting goals, then the most important thing is not just writing schedules but acting to follow that schedule, right? So acting upon the goals, the set goals. So once you start working on your goals, then it is very much important to reinforce learning, intermittent, like periodic intervals to reinforce learning, which is very important because it helps in reviewing and repeating what you're learning, right? So finally, after reinforcing, evaluating results and making necessary changes, whether these goals are relevant or not, if at all any modifications are needed for that population. So based on, we'll get all this information after thoroughly evaluating the results, right? So that completes the educational process. So first, recognizing needs, CAB, as most of you rightly mentioned, CABEFGD. So recognizing needs, expressing needs, stimulating motivation, setting goals, acting to achieve goals, reinforcing learning, and then evaluating results. Okay? So these are some of the steps in your educational process. You can just make a note of them, or you can just write the right order in the soft copy. Finally, 10th question, assertion and reason. Rubber dam isolation is not popular among clinicians is the assertion, and the reason is rubber dam isolation is time consuming. So you have options, assertion, both are true and reason is justifying, both are true but there is no justification. A is false, B is true, A is true, B is false, right? So give me the right answer. Rubber dam isolation is not popular among clinicians is the assertion, and the reason is it is time consuming. Yes. So you have two sides of the coin here. As per the literature, your rubber dam isolation is the best, but clinically speaking, most of the practitioners are not following this rubber dam technique. That's a different scenario, right? Since we're discussing theory, it would be more appropriate if we go as per the literature. So rubber dam isolation is not popular among clinicians. Reason, it's time consuming. So what is the final answer? Yes, Divya, we don't have that option, right? So as per the textbook literature, rubber dam is, isolation is the best way of isolating, right? Isn't it? Ideal way of isolation. So A, rubber dam isolation is not popular among clinicians, it's a false statement, right? We'll not go based on the clinical scenario now. Because if you go based on clinical scenario, then you'll land yourself in. So we'll go as per the literature. Even though practically speaking, most of us don't use rubber dam, that's a different side of the story. Let's leave it. Let's limit ourselves to academics. So academically speaking, rubber dam isolation is not popular, is a false statement. It's considered to be of highest standard and it's the best way of isolation, right? So A is false as per the question. And reason says it is time consuming. How many of you agree with the fact that it is time consuming, or how many of you disagree, saying that it doesn't take much time? Yes, it depends on the clinician. That's why I said we'll not go based on the clinical knowledge or clinical perspective, we'll stick based on the literature. Time consuming. Okay. You just go through the statement given in your Grossman. By the way, rubber dam was introduced by? Okay, those who are saying Prithvi in her case, saying it's time consuming, right? Have you ever tried rubber dam routinely in your clinical practice? Yes. S.C. Barnum, right? Good. Vijay Lakshmi, Angel. Yes, S.C. Barnum, 1893, approximately, right? So, the only thing he has said is, it's not really time consuming. In fact, the only challenge we have with rubber dam is not because it's taking more time, but it is the difficulty to convince a dentist to use it. So it's the psychology of a dentist. It's not really time consuming. You practice it day-to-day basis, you will take less than 1 to 2 minutes time for single tooth isolation. If it's a quadrant isolation, maybe you will take an additional 3 to 5 minutes, which is worth investing with your 400 dentistry, right? So it is worth investing. So if it is given as it is time consuming, going by the literature, it is false. It's not time consuming, and we have done it practically. I mean, every PG in Indore, we get used to using rubber dam on day-to-day basis. It is not at all time consuming. The only challenge with rubber dam is convincing the operator to use the rubber dam, according to Barnum also. So both statements are false as per the literature, right? Sorry, everything is here. I can't use Hindi. I mean, you can take help of our friends if you want anything in Hindi. So Abhishek, you used Octodam. Octodam is anatomically conforming dam, Insti-dam, disposable dam, right? These are again important 2 marks questions for you. Also, we had one image-based question pertaining to this Octodam in our test series. Yes, both are false. Rubber dam has to be done, like here's the standard of care. It shows when you're using rubber dam, it represents or it gives the standard of care which the operator is employing in his clinic, and it's not time consuming. You'll get used to it, Sophia, once you start practicing. It's all about practice, right? See, initially, even in second year, when you start working on your maxillary teeth in indirect vision, you feel it's impossible to work, isn't it? But with time, with practice, we get used to it. So, the same thing here also. So, both statements are false, right? So, no further discussion required on this, and maybe, I mean, this is an odd one out. Can't expect such questions in an entrance. You'll definitely have least complicated questions or questions with least or no controversy. So this completes our 10 questions. So actually I wanted to discuss these 10 questions today morning itself. I made all my arrangements, but unfortunately I couldn't make it live at 6 a.m. So we'll stop here immediately as soon as possible. It's already 6:55. We'll again come back live at 8 p.m. with a specific topic, right? I'm sure you're going to enjoy that topic. We have many new points, very interesting points to learn at 8 p.m., right? So see you again at 8 p.m. I hope you enjoyed this live session, and I hope you got some important points pertaining to today's discussion, right? I'll share the pic later in our Google group as well as WhatsApp update group. Yeah. See you at 8 p.m. again. Maybe in 1 hour. Yeah. Bye. Take care. Love you all. Yes, Sanjay, drop a mail. I'll send you the details of my camp. By the way, I'm using my mobile phone now. The Tuffy is taking break. She'll be back at 8 p.m. Okay? Yes, you're all welcome.